This is John Geaver for MedPage Today. A common complaint among women undergoing adjuvant chemotherapy for breast cancer is mental problems, often called Chemobrain. They say they feel their thought processes are slowed down and foggy. However, a new study suggests that at least some of this impairment predates the chemotherapy. Dr. David Darby of CogState Limited, an Australian company that develops tests for cognitive function, led the study. Dr. Darby's group studied 30 women beginning prior to starting chemotherapy, retesting their cognitive function throughout their treatment. Their baseline cognition was also compared with a control group of women without breast cancer.
The study that we did attempted to do a prospective longitudinal study looking at women with two types of chemotherapy regimes. Our study first assessed these women after their diagnosis and after they had had their mastectomies, but before they had their first treatment of chemotherapy. And at this time, our study found that there was a subtle but reliable impairment in learning and also a milder depression scale decline in these same groups of women. It's possible that these are correlated. None of the women that were in our study were clinically depressed or were on antidepressants, for example. This sort of learning impairment prior to chemotherapy has now been described on several occasions, and it suggests that there is something special about women who have chemotherapy before they even have the chemotherapy. Secondly, our study followed these women for their cycles of chemotherapy, testing them with a computerised battery every month just before their next cycle of chemotherapy. And what we found was that during these cycles of chemotherapy, there was a slight improvement in some accuracy measures of learning and what's called working memory, but there was a mild decline in some psychomotor measures. These are measures of speed and efficiency, the sorts of things that we might associate with concentration. These were very mild changes, and they were of the order, I guess, of the way I'm feeling, a bit jet-lagged after coming from Australia. So equivalent to about 17 hours of staying up. In addition, though, there were also correlations between these subtle slowings in speed and concentration with their own subjective feelings of their cognitive abilities. In other words, this may be an explanation for some of the complaints that women have when they complain about their concentration and memory, because there was a correlation between their subjective feeling of impairment and the speed at which they processed information. We also then finally followed these women up at 28 days after their last cycle of chemotherapy, and the subtle impairment in information processing was still present, but the other interesting fact was their anxiety levels had improved, as had their accuracy on learning and working memory tasks. So the summary of our research is that, first of all, prior to chemotherapy, there is a subtle but reliable impairment in learning. And then after chemotherapy, there is a minor slowing in abilities that are related to what we call psychomotor or information processing speed. The other aspect of this was that the impairment was actually relatively infrequent. Only 3 of the 30 women that we evaluated had persistent impairment. That's about 10% of these women. And the persistent impairment was defined as impairment on 2 consecutive occasions. In addition, finally, the depressive symptomatology seemed to slightly increase with chemotherapy, in addition to their subjective perception of their own impairment, which did seem to correlate with a very mild impairment in cognitive function for processing of speed.
I'm John Geaver, MedPage Today.